Hello friends, I am Dr. Dattaram. I am a senior consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad. So today I thought I will discuss the symptoms of gallstones, and most of the patients who come to me, sometimes they would have already done a scan, an ultrasound scan, and that shows gallstones. So one of the common things what they ask is the stone size is small, yeah. So the symptoms and stone size. So recently I had a patient, very young patient. She's getting recurrent, repeated attacks of upper abdominal pain. So she got a scan done, and there is the scan reads as there is small microstones or something we call as sludge in the gallbladder. So she is very confused about saying that the stone is small. Why should I undergo surgery? I actually asked her to undergo surgery, and she is confused, like why should I undergo surgery because stone is so small, and why do you want to remove an organ? So see, when gallstones, the problem of gallstones is very common. If you see, at least 20 to 30% of the population will have gallstones. So most of them are asymptomatic. So once they start getting symptoms, that is a pain, recurrent upper abdominal pain, especially after eating a fatty meal or any meal, they get severe upper abdominal pain. So when you get pain, there's a time when you should go for surgery. If you have asymptomatic stones, then you can wait till you get symptoms. Because once the stones become symptomatic, there's always a chance that you'll get a complication. And the stone problem, the problems what you're having will not go away with medicines. So the best thing is to go for surgery. Surgery is very simple. So regarding the stone size, so a lot of people are asking like, the stone is small, why should I undergo surgery? So it is not the stone size which is important, it is the symptom. So small stones, the sludge, what I mean is, can be really more problematic. The small stone, they slip easily into the bile duct, so they pass into the intestine and cause pancreatitis. So pancreatitis is a very serious condition, so don't take it lightly. So pancreatitis can have very serious problems, so that can land you up in many serious problems. And don't go by the stone size. So if you have symptoms, definitely go for surgery at the earliest date. Don't try to keep on waiting for symptoms to come repeatedly and have developed complications and all. So the moment you get symptoms, the earliest you should plan surgery, because without surgery this problem is not going to go. And stone size is not the criterion, it is the symptom and complication. So regarding the surgery, most of the people are worried, you are removing the organ. So for any gallbladder related problem, the simplest thing is removing the gallbladder. It's a very simple problem, and gallbladder is not a vital organ, so you can live without the gallbladder. So once you get stones, the function of the gallbladder is gone. So gallbladder doesn't have any major functions. It's a 50 ml capacity organ. It will store bile, and when you eat food, it will pump bile. That's the only function it has. So even if you don't have the gallbladder, all the bile, around 1.5 to 2 liters of bile which is formed in the liver, will go into the intestine. So don't worry about that. Your digestion will not get affected. The surgery is very simple. Only 1 day stay. You do all your tests, do your anesthesia checkup. On the day of surgery, you admit, and then you do the surgery. So surgery will last for around 2 hours. So it's a keyhole surgery. So the cuts are very small. Within 2 to 3 days you will recover, and within 2 to 3 days you can go back to your office. So it's a very simple thing. So and one important thing is that we don't remove the stones alone, we remove the entire gallbladder. So don't go by the stone size. Don't get worried whether your digestive system is going to be intact or not. It is going to be very normal after surgery, and the recovery is very quick. The pain of surgery is very minimal, so it's a very commonly performed operation. So don't try to get these gallstones managed medically, even if you have symptoms. So please go for surgery at the earliest. Don't invite complications. So unlike kidney stones, gallstones are totally different. The complications are very severe, and they can be life-threatening also. Thank you so much. My name is Dr. Dattaram. I am Senior Consultant Surgical Gastroenterologist and Laparoscopic Surgeon practicing in Hyderabad. Thank you so much.